Now, if you have observed in head and neck portion, most of the structures of the neck are over. I don't know whether you have observed it or not. Okay, most of the structures of neck are over. Not all, most of the structures are over. In dissection, few topics are left that will be taken during the dissection only. Now we have to go further. Okay, for that, today I will be starting from the oral cavity, structures of the oral cavity. Okay, so mainly in oral cavity we have to discuss, we have to give more focus on tongue. Okay, we have to give more focus on tongue. So first I'll give you a brief overview of the oral cavity and then directly we'll go to the tongue. Now in histology you have studied about the tongue, if you remember, microscopic structure, right? Now here we will not discuss the microscopic structure, instead of that we will be discussing the gross anatomy of tongue. Okay, gross anatomy of tongue is very important. You can expect some questions, okay, from gross anatomy of tongue, very important. From gross anatomy also and from embryology also, questions from the tongue are generally asked. Okay, so I will request everyone to listen carefully and try to understand the gross anatomy of tongue. So we'll start with the oral cavity. Okay, now what you have to know about the oral cavity? So as earlier you have studied about any of the cavity, we have to define the boundaries. Similarly here also, if oral cavity is there, we have to know the boundaries of the oral cavity, from where to where it is extending. Okay, if a cavity is there, it will be extending. Then whether it is communicating to any other parts or not. For example, this oral cavity is communicating with what, that we have to know. Okay, and along with that, what are the parts, whether the cavity is intact or whether it is divided into smaller parts. Okay, only those things we have to know about the oral cavity, followed by the structures, where we will be discussing in detail about the gross anatomy of tongue. So the oral cavity is also called as mouth or buccal cavity. Okay, and serve as a first part of digestion. In digestive system, first part of digestion takes place from the oral cavity. Now if you see, it is situated anteriorly on the face below the nasal cavity. So face already we have discussed. So on the anterior aspect of the face, the oral cavity is situated, and it is situated below the nasal cavity. Okay, so the nasal cavity is above, oral cavity is below. Can anyone tell me the name of the partition between the oral and the nasal cavity? Two cavities are there, nasal cavity and oral cavity. What is the partition? It is hard palate. Okay, hard palate is making the partition between the nasal cavity and oral cavity. Okay, so in you are studying skull, right? So when you are studying skull, during the time of Norma Bezalis, at that time we will be studying about the hard palate. Okay, the bones forming the hard palate, sutures present in the hard palate. Now anteriorly, so that is the location of the oral cavity. Now if you see anteriorly, it opens to the face through oral fissure. Okay, so this is the oral fissure. Through oral fissure it is opening and it is communicating with the exterior. Now if you see posteriorly, the oral cavity, where it goes. Now the posteriorly, the oral cavity communicates with the oropharynx. That means it is a part of pharynx through a narrow passage that is called as oropharyngeal isthmus. Okay, so posteriorly the oral cavity is communicating with the oropharynx. Now we know that three parts are there of the pharynx. What are those three parts? Yes, this side, last bench. Come and sit here in the first, both of you. Both of you come and sit in the first bench. In oral cavity, as I said, it is communicating anteriorly with the exterior, okay, with the face, and through oral fissure, and posteriorly where it will go. Posteriorly it is communicating with the oropharynx. Okay, when you will study pharynx, at that time you will come to know there are three parts of the pharynx: nasopharynx, oropharynx and laryngopharynx. Okay, so this oral cavity, posteriorly it is communicating with oropharynx by a narrow passage which is called as oropharyngeal isthmus, right? So these are the connections, you can say connections or communications of the oral cavity. Okay, Now, if you see the oral cavity, it is very small, but it is having unique structure and delicate structure of nerves, blood vessels are present inside the oral cavity. Okay, which makes it a bit complicated. Okay. Now, if you have to study the oral cavity, the structure of oral cavity, then what we have to do? We have to divide the cavity. Do you remember the mediastinum? When you have studied about the mediastinum, how you have studied the mediastinum? You have divided it, right? You have divided the superior mediastinum, inferior mediastinum, and then again anterior mediastinum, middle and posterior mediastinum. Why you have divided the mediastinum? So that you can study it properly, so that you can study easily. You can understand the structures what are present, right? Similarly, whenever in most of the cases you will see in our body, the cavities, whenever they are present, it is being divided into smaller parts so that it can be studied easily, right? Similarly, the oral cavity which is there, okay, if you see the structure of the oral cavity, it is also divided into two parts, okay? Now, the oral cavity is surrounded by lips, cheeks, palate and a muscular floor, okay? These are forming the boundaries. So, it will be surrounded by lips, it will be surrounded by cheeks, it will be surrounded by palate and muscular floor, okay? And above what we are getting? We are getting the palate, which is forming the roof of the oral cavity, okay? So, if you see the oral cavity, it is having a roof, it is having a floor which is muscular in nature, and then it is also having lateral walls, right? Lateral walls are mainly formed by which part? Lateral walls are formed mainly by the lips and the cheeks. So it will go anterolaterally. Next, the oral cavity is divided into two parts. What are they? Okay, two separate regions. These are the vestibule and the oral cavity proper. Now, what exactly is that vestibule? Where the vestibule is situated? Vestibule is the area between the cheek, lip and teeth. Okay, so between the lips, okay, between the cheeks and teeth and gum, the area which is present, that is called the vestibule, and the oral cavity proper. So these are the division of oral cavity, or you can say buccal cavity, right? Let me show you the diagram. Now here you can see the diagram. Now in this diagram, this is the oral cavity proper and this is the vestibule. Now have you understood which part is the vestibule and which part is the oral cavity? Okay, so two separate areas. So entire oral cavity is divided into two parts, right? Oral cavity proper and vestibule. Now in this diagram you can see the vestibule and you can see this is the oral cavity. So vestibule, where it is present? It is situated in between the lips, then teeth and gum. Okay, so this is the area. Now this is not present anteriorly, it is going laterally also on both the sides. Okay, so that is the area which is called as vestibule. And here you can see this is the oral cavity proper. Now this is a coronal section of the oral cavity. Here also you can see this is the oral cavity proper and these are the vestibule. Okay, these are the vestibule of the mouth. Now if you see the oral cavity proper, okay, so that is also a cavity. Now what is the boundary? Anterolaterally oral cavity is bounded by teeth, gum and alveolar arches. So we have studied the microscopic structure of tooth, right? At that time I have told you how they are attached into the alveolar arches. Okay, so if you see the boundaries of the oral cavity proper, first what you are getting? You are getting the teeth, gum and alveolar arches. So see here you can see teeth, they are attached to the gum. These are the gum and the alveolar arches, you can see these are the alveolar arches. Okay, so that is forming the boundaries of the oral cavity proper. Okay, next the roof of the oral cavity proper is formed by the palate, hard palate. Along with that, posteriorly soft palate is also there. Okay, I am talking about the roof which is dividing the nasal cavity and oral cavity. And if you see the floor, it is muscular in nature. Okay, and mainly if you see the floor, it is occupied by tongue posteriorly. In the oral cavity, what is present? On the posterior aspect, tongue is present. Okay. Next, on the anterior aspect, just below the tongue, a small area is there that is called a sublingual region. Okay, sublingual region, anterior to the tongue. The sublingual region is there. In sublingual region also important structures are present. Okay, can you tell me what are the structures present in the sublingual region? That means this is the tongue, right? If you elevate the tongue, then you can see the sublingual region. Okay, so what you can see in the sublingual region? Frenulum is there. Okay, this muscular fold, frenulum is there, and on the either side of the frenulum, sublingual papilla, where opening of the submandibular salivary gland is there. Okay, then opening of the ducts of the sublingual glands are present. Okay, then you can see the deep lingual vein also. So these are the structures which you can see in the sublingual region or sublingual area. Okay, so see, I was talking about this particular area. Okay, the sublingual region represents the different structures. For example, the median plane, there is a fold of mucous membrane from the inferior aspect of the tongue to the floor of the mouth, that is called the frenulum. Here you can see the floor of the, in the floor of the oral cavity proper, you can see a mucosal fold, okay, which is attaching the tongue to the floor of the mouth, that is called as frenulum, and it is present in the midline. Next, on the either side of the frenulum, you can see sublingual papilla are there. Okay, in the sublingual papilla, what will be there? Opening of the submandibular duct. That means opening of the duct of the submandibular salivary gland. Okay. Next, if you go more laterally, backwards from the sublingual papilla, there is a fold that is called sublingual gland. Okay, so a mucosal fold will be there. Below that, sublingual glands are present. This particular area, okay, where sublingual glands are present. So this particular area is present on the anterior aspect of the oral cavity, that also just below the tongue. Okay, that's why it is also called a sublingual region. Okay, next is the vestibule. Okay, so oral cavity proper and the vestibule. So the boundaries of the vestibule already shown in. Now what is present in the vestibule? Okay, so vestibule is a very narrow space. Now how it is bounded? You can see it is bounded externally by the lips, cheeks, and internally by the teeth and gum. In between this, the space which is present, it is the vestibule. Now the vestibule of the mouth can easily communicate with the oral cavity proper, even when the teeth are occluded. Occluding of the teeth means, suppose you are doing like this, both the teeth of the upper jaw and lower jaw are in contact with each other, that is called occluding. After that also, the vestibule can communicate with the oral cavity. Okay, so with the open mouth, it communicates freely with oral cavity proper. Even when the teeth are occluded, at that time also they can communicate. Now the question is, why we are studying about the vestibule of the mouth? Right, because in the oral cavity you can see tongue is present and other structures are also there. Okay, few I have shown, few will be discussing later. Now what about the vestibule? Why we are studying about the vestibule? Can you guess what structures are present in the vestibule? Mainly in the vestibule you will be getting the opening of the ducts of some salivary glands. Okay, जो vestibule होता है, is in that vestibule you will be getting some ducts of the salivary glands which are opening. That's why vestibule is important. Okay, so you can see the parotid duct opened into the inner surface of the cheek, where opposite to the crown of upper second molar tooth. Okay, opposite of the upper second molar tooth, that also in the vestibule. It is the opening for parotid duct, means duct of the parotid gland. I hope you have studied about the parotid gland, right? Next, you can see numerous labial and buccal glands are also there, situated in the submucosa of the cheeks. They also open into the vestibule. Okay, so apart from the main salivary glands, some minor salivary glands are also there. Those openings are also taking place in the vestibule. Okay, next, 4 or 5 molar glands situated in the buccopharyngeal fascia, they are also opening into the vestibule. Okay. So that's why vestibule is important, because the opening of the glands, the secretion of the glands are coming out in the oral cavity through this vestibule. Okay. So that is all about the vestibule. So in oral cavity we have seen the boundaries of the oral cavity, then two parts of the oral cavity, that is oral cavity proper and the vestibule. In each and every cases we have seen the boundaries. Okay. Now if you want to see the contents of the oral cavity, okay, one of the most important content is tongue. Okay, and we'll be discussing in detail about the gross anatomy of tongue. Now, while explaining about the histology of tongue, okay, if you remember, those students who have attended the class, I have given a brief introduction about the tongue. Do you remember? Yes. So, what are the parts of the tongue? Okay, first of all, you know that tongue is made up of what? The main mass of the tongue is made up of skeletal muscles. Okay. Very good. So it is a muscular organ. It is a mobile muscular organ situated in the floor of the oral cavity. Okay. Now, if you see, it is bulging upwards from the floor. Okay, from the posterior part, and then it is extending up to the anterior wall of the oropharynx. That is the extent of the tongue. Next, essentially, it is made up of skeletal muscle. That means the main thickness or main bulk of the tongue. Okay, it is made up of skeletal muscles. Do you remember how many skeletal muscles are there? 8. And that also it is divided into two types, extrinsic and intrinsic muscles. Yes. Now, one thing which I have not mentioned that day, that is the tongue, the muscle mass is separated into right and left half by a midline furrow. Okay. Or you can say median septum is there, which is dividing the muscles of the tongue into right and left halves. Okay, and all the muscles are voluntary in nature. Next, what are the functions of the tongue? In production of speech, taste, mastication, and deglutition. These are some important functions of the tongue. Already you know that. Okay. Now, in the parts of the tongue, so first of all, it is having a root, which is the attached part. What are the parts of the tongue? First of all, a root is there. Root is the attached part. Okay. Now, the root cannot be seen. Whenever you are opening your mouth, okay, in front of a mirror, if you stand in front of a mirror and open your mouth, you can see the parts, but you cannot see the root. Why? Because it is the attached part, situated posteriorly, that cannot be seen. Okay. Next, a tip portion is there. Okay. Root is there, tip is there, and body. Okay, now in the body of the tongue, two surfaces are present, the dorsum of the tongue and the inferior surface of the tongue. Now, which is the dorsum of the tongue? Just after opening the oral cavity, okay, without doing any movement, whatever you see, that is the dorsum of the tongue. Okay, and if you elevate the tongue like this, if you elevate the tongue, then you can see the inferior surface of the tongue. Okay, structures which are present on the dorsum and structures present on the inferior surface, both are different. It's not same. So you have to understand the differences. Okay. So we'll start one by one. Can anyone tell me which is the dorsum of the tongue and which is the inferior surface of the tongue? This diagram I have shown you earlier while discussing about the histo. This is the dorsum of the tongue, okay, and this is the inferior surface of the tongue. Okay. Why I am showing you this diagram? Because you can see the structures are different. Okay, the arrangement of the structures are also different, the relations are different. Okay, that's why you have to understand which is the dorsum of the tongue and which is the inferior surface of the tongue. And along with that, the appearance is also different. The dorsum of the tongue and the inferior surface, the appearance, these are also different. Okay, so we'll start one by one. First, we'll see the root of the tongue. Okay, the root of the tongue is the attached part. Okay, tongue is also having attachment. Now, you have noticed that different types of movements are possible with the help of the tongue. Whenever you are speaking or whenever you are swallowing something, at that time you have seen that you can do various movements with the help of the tongue, right? So it is highly mobile in nature. So one part which is highly mobile in nature, okay, that can be seen, and the part which cannot be seen, that is the attached part. Okay. So the question is where it is attached. The tongue, where it is attached. Can you guess what will be the attachment? Can you guess what will be the attachment? See, the attachment is divided into superior attachment and inferior attachment. Okay, like this the attachments are divided. So if you see the root, superiorly it is attached to the styloid process. Okay, see it is attached to the styloid process and soft palate. So these structures are situated above the tongue. So these are the superior attachment. Now inferior attachment, where it will be attached? Inferior attachment, it is attached to the hyoid bone and it is also attached to the mandible. Okay, so these are the attachment. Root is attached to the styloid process and soft palate above, and to the mandible and hyoid bone below. Okay, these are the attachments of the tongue. So in order to understand the tongue attachment, please note that it is divided into two parts: superior attachment and inferior attachment. Superiorly कहाँ पे attach रहेगा? Styloid process and soft palate. Okay. Now, what do you think? How they will be attached? By the help of? They will be attached. Something must be there, right? What is the thing that will attach the tongue with the styloid process and soft palate? Any idea? These are nothing but the muscles, extrinsic muscles. Okay, they are coming from styloid process, they are coming from soft palate, they are coming from hyoid bone, they are coming from mandible, and then they are inserted in the tongue. So that I am talking about that attachment. So like this, it is attached with the superior attachment and the inferior attachments. Okay. Now because of this attachment, okay, though tongue is having root which is attached, okay, we don't swallow the tongue whenever we are swallowing something after chewing the food. That is also an important reason. Okay. Now in between the mandible and the hyoid bones, the geniohyoid and mylohyoid muscles are there, very important muscle. Okay. And these muscles are nothing but the muscles of the tongue, extrinsic muscles. So we'll be discussing those also. Next, if you see the tip of the tongue, okay, it forms the anterior free end. Okay, this tip portion, anterior free end, which is highly mobile, and it is situated just behind the incisor teeth. Okay, upper incisor teeth. That is the location of the tip portion. Next, so two portions are there. Next, the dorsum of the tongue, two surfaces. Okay, the body is having two surfaces, the dorsum of the tongue and the inferior surface. Okay. Now, do you remember the divisions of the dorsum of the tongue? So this is the dorsum of the tongue, right? Body of the tongue का कितना surfaces है? How many surfaces are there? Two surfaces are there. Dorsum of the tongue, and this is the inferior surface, right? Now in the dorsum of the tongue, do you remember the parts? Three parts are there. Okay, first of all, it is divided into anterior 2/3 and posterior 1/3 by a sulcus terminalis. You can see this is the sulcus terminalis, which is dividing the anterior 2/3 and posterior 1/3. Okay, and the sulcus terminalis is V-shaped, where both the limbs they are meeting. In that particular part, a small depression or pit is present. That is called as foramen cecum. Okay, during intrauterine life, thyroglossal duct is passing through this particular area. That's why a small pit or depression can be seen. Okay, so I am talking about this part. See, this is the anterior 2/3 of the tongue, and this is the posterior 1/3 of the tongue. Now both are divided by this sulcus. This is called as sulcus terminalis. Now if you see the sulcus, what is the shape of the sulcus? Can you see? It is V-shaped. Okay, inverted V-shaped. Now both the limbs of the V, they are meeting at a point where a depression or a pit is there. It is called as foramen cecum. Okay, why a depression or pit is present? Because during intrauterine life, thyroglossal duct is passing through this particular part. That's why you can see the depression. Okay, so like this we are getting two parts. So this is the anterior 2/3 and this is the posterior 1/3. Next, a posterior most part is also there, situated behind the posterior 1/3, where that part is attached to the epiglottis. Okay, that part attaches the tongue to the epiglottis. Okay, so like this, the dorsum of the tongue is divided into three different parts, right? Now, those particular parts, the nerve supply, especially of those particular parts, are not same. It is different. Even the features of those particular parts are different. So that you have to understand. So root already I have mentioned where it is attached. Okay, dorsum of the tongue, it is divided into three parts. Okay, first of all, as you can see, the oral part is also called as anterior 2/3, and the pharyngeal part, that is the posterior 1/3, by a faint V-shaped groove that is called as sulcus terminalis. Okay, and the median pit where both the limbs of the V meet, this is called as foramen cecum. Okay, and lastly we are having the small posterior most part. It is directed backwards towards the oropharynx. Okay, and that will attach the tongue to the epiglottis. Okay. Now, what do you think? What will be present in the oral or the papillary part? The oral or the papillary part is placed in the floor of the mouth. Okay. Now, this particular part is separated from the teeth. Have you observed that the tongue, when you are not doing any movement with the tongue, okay, just open your oral mouth and stand in front of the mirror. Okay. Don't do any movement with the tongue. Okay. Then you will see that tongue is separated from the teeth. There is a small gap. Okay, actually that is called as sulcus. Tongue is not attaching to the teeth. There is a small gap. Okay, or the sulcus. Now that sulcus is called as alveolo-lingual sulcus. So the tongue separated from the teeth by a sulcus, deep sulcus, that is called alveolo-lingual sulcus. Now that sulcus is filled by palatoglossal fold. Okay, or also called as palatoglossal arch, which is extending from the lateral aspect of the tongue to the soft palate. Next, in case of the anterior 2/3 of the tongue or the oral part of the tongue, okay, it is rough. Now, why it is rough? This anterior 2/3 of the tongue is rough in nature. Why it is rough? Because of the presence of papillae. Okay, so you have studied about the papillae. We have studied about the papillae in histo. Okay, so that's why I am not repeating it, but please keep that in mind that the anterior 2/3 of the tongue is rough. Why it is rough? Because of the presence of papillae. 4 different types of papillae are present. Okay. Next, if you go posterior 1/3, that is also called as pharyngeal part. Okay, or also called as lymphoid part. Now this particular part is situated behind the palatoglossal arch and behind the sulcus terminalis. Okay, behind the sulcus terminalis, this posterior 1/3 or the pharyngeal part of the tongue is situated. Okay. Now the posterior surface sometimes is also called as the base of the tongue, and it is forming the anterior wall of the oropharynx. So that particular part of the tongue, okay, is forming the anterior wall of the oropharynx. Okay. Now mucous membrane of this particular area, that means the posterior 1/3 of the tongue, it doesn't have any papilla, but still it is rough in nature. Why? Because of the presence of aggregation of lymphoid follicles, and those are called as lingual tonsil. Do you remember the Welders ring? In histo demonstration we have discussed about the Welders ring. Okay, I have told you where the aggregation of lymphoid follicles are present, how the Welders rings are there, and we have discussed about the palatine tonsil. Okay, so this aggregation of lymphoid tissue, okay, will form the lingual tonsil, and mucous membrane is also present. Mucous glands are also present in that particular area. Okay, so that is the posterior 1/3. Okay, let me show you the diagram again. So I was talking about this particular area. So this posterior 1/3 of the tongue or the pharyngeal part of the tongue is situated posterior to the sulcus terminalis. So this is the sulcus terminalis. Posterior to that, this posterior 1/3 or the pharyngeal part of the tongue is situated. Okay. Now this particular part is also rough, and in this particular area you can see aggregation of lymphoid follicles. Okay. Now, and along with that, mucous glands are also present, and those aggregation of lymphoid follicles are called as lingual tonsil. Okay. Next, the posterior most part. Okay, posterior most part of the tongue is connected to the epiglottis by 3 folds of mucous membrane. Okay, those are called as glossoepiglottic folds, 2 lateral and 1 median. Have you heard about epiglottis? Anyone, have you heard about epiglottis? क्या होता है epiglottis? Actually, it is a leaf-like structure made up of fibrocartilage. Okay, it helps in deglutition. It prevents the entry of food, whatever we swallow, okay, to the trachea. That is the main function of the epiglottis. So, the posterior most part of the tongue, okay, and regarding epiglottis, we will discuss in other stages of deglutition. Okay, very interesting topic. So, the posterior most part of the tongue is connected to the epiglottis by 3 folds of mucous membrane. These are median glossoepiglottic fold, right and left glossoepiglottic fold. Okay, so 3 folds of mucous membrane are there, which will connect the posterior most part of the tongue to the epiglottis. Next, on the either side of the median fold, a depression is there. Okay, and that is called as velacula. 2 depressions are there, 1 median fold on either side, 2 depressions are there, and that is called as velacula. Now, the lateral folds of the velacula will separate. The lateral fold separates the velacula from a recess. It is called as piriform fossa. Now, let me show you the diagram again. Now, can you see the folds? So, see, this is the median glossoepiglottic fold, and these are the lateral glossoepiglottic fold. And on the either side of the median glossoepiglottic fold, you can see the depressions are there. It is called as velacula. Okay. Now, on the either side of the median fold, the depressions are called as velacula, and the lateral folds separate the velacula from a recess that is called as piriform fossa. Okay. So, what exactly is this piriform fossa? Anyone, have you heard about this piriform fossa? No. Okay. So, piriform fossa, actually it is also called as piriform sinus. Actually, it is a recess which is situated on the either side of the hypopharynx. Okay, as you can see, recess of the hypopharynx located posterolaterally on the either side of the laryngeal opening. Okay, here you can see. So, this is the piriform fossa, or also called as piriform sinus. On either side of the laryngeal opening, a recess is there. Okay, that is called as piriform fossa or piriform sinus. Now, this piriform fossa, piriform sinus also helps during the time of deglutition or during the time of swallowing. Okay, there is a very interesting clinical part related to this piriform fossa. Okay, now this piriform fossa is also called as smuggler's fossa. Have you heard about it? This piriform fossa is also called as smuggler's fossa. In earlier days, nowadays technology is very advanced. You cannot smuggle things in airport. Previously, to smuggle things, precious item, for example, diamonds and all. Okay, they used to put in the piriform fossa to smuggle things. Okay, that's why it is called as smuggler's fossa. Okay, don't try it. Okay, so that is the posterior most part of the tongue. Next, the papillae of the tongue. So, papillae of the tongue already we have discussed, right? Yeah. So, in the papillae of the tongue, what is the structure of the papillae? How the papillae are made up of? First of all, we know that the anterior 2/3 of the tongue, okay, is rough. Why it is rough? Because of the presence of papillae. Now, the condition is this papillae, these are the projections, right? Now, how the papillae are made up? That means it is made up of what? As you can see, each papillae consists of lining epithelium and a core of connective tissue. Okay, so the covering will be there of lining epithelium and the core is made up of connective tissue. Like this, the papillae are formed. Okay, now and because of the papillae, anterior 2/3 of the tongue is rough in nature. Now, how many types of papillae are there in the tongue? 4 types of papillae are there. What are they? First is the circumvallate papillae, then fungiform papillae, foliate papillae, and filiform papillae. These are the 4 different types of papillae present in the tongue. Okay. Now, so the main function of the papillae is to make the tongue, the surface of the tongue, rough. Okay. What is the other function of the papillae? Yes, very good. So taste buds are also present. Now all the papillae doesn't have taste buds. Mainly the circumvallate papillae and fungiform papillae, taste buds are associated with them. Okay. So regarding the taste bud, the structure of the taste bud already we have discussed. If you remember how the taste sensation is carried, that also I have discussed. Okay. Now, which is the largest papillae? By the way, circumvallate papillae. Okay, is the largest papillae of the tongue. So if you see the size, 1 to 2 millimeter in diameter, 8 to 12 in number, exactly they are situated in front of the sulcus terminalis. Okay, if you see the projection, this cylindrical projection surrounded by circular sulcus. Okay, cylindrical projection will be there and a sulcus will be there. So on that sulcus, the lateral walls which are present, in that lateral walls, taste buds are present. Okay. Next, you can see the fungiform papillae, where they are present at the tip and the margins of the tongue. Okay, and they are also scattered in the dorsum of the tongue, over the dorsum of the tongue. Each papillae consists of narrow pedicle and large rounded head. The pedicle is narrow and the head is large rounded. That is the shape of the fungiform papillae. So each and every type of papillae, the location and the shape are different. I hope you remember this diagram. I have shown this diagram earlier. Okay. Next, the filiform papillae. These are conical papillae, pre-sulcal area. Okay, just in front of the sulcus, and this gives the tongue a velvety appearance. And these are the smallest and most numerous papillae. This filiform papillae. Okay. Now, if you see the apex of the filiform papillae, they are split into filamentous process. Okay. And lastly, the foliate papillae. The amount of foliate papillae are very less. Okay. They are leaf-like, and these foliate papillae are not well developed in case of human being. Okay. Now, in the diagram, you can see the different types of papillae. See, this is the circumvallate papillae. Okay. Now, this is the fungiform papillae, and along with the circumvallate papillae, you can see the taste buds are present. Okay. तो जो पेपिले होता है उसका 2 functions होता है mainly. First function is it will give the dorsum of the tongue roughness, characteristics roughness. Now, can anyone tell me why this dorsum of the tongue is rough? That day I have given a very nice example. Why I am asking? Because most of the students were absent that day. ये जो dorsum of the, have you please ask questions to yourself. ये जो dorsum of the tongue है, ये वाला पार्ट, why it is rough? पेपिला है because उसमें taste buds है, तो whatever you are eating, you have to feel the taste. That's why taste buds are present, right? But पेपिले क्यों रहता है? Why the papillae are present? Again, I will repeat the example again. Everyone, most of the student loves ice cream. How do you eat ice cream? You don't bite the ice cream, right? आइसक्रीम कैसे खाते हो? हाँ, तो that's why the tongue has to be rough. If the tongue is smooth, you can't lick the ice cream. Okay, this is an example to make you understand. Don't write this in the exam. I have seen students are writing all those things. ठीक है? So this is an example to make you understand why the surface of the tongue is rough. Okay, and along with that, papillae are there. Okay, and along with the papillae, taste buds are present to get the taste. Next, the inferior surface of the tongue. Taste buds already we have discussed, so I will not repeat it again. Next, the inferior surface, or also called as ventral surface of the tongue. When you elevate the tongue, at that time you can see the ventral surface or the inferior surface of the tongue. Okay, it is situated in the oral cavity. The mucous membrane is very thin and smooth. So जो inferior surface है, this one here, in inferior surface you will not get any papillae. Though papillae are absent, that's why this particular part of the tongue is smooth in nature. Okay, it is not rough. Next, what are the structures you can see? First of all, frenulum linguae, or also called as the frenulum of the tongue. Okay, that is a fold of mucous membrane situated in the midline, connecting the tongue to the floor of the mouth. Okay. Next, deep lingual veins. If you go on the lateral aspect, okay, of the frenulum, at that time you can see the deep lingual vein present on the either side. And then plica fimbriata. This is also a fimbriated fold of mucous membrane lateral to the deep lingual vein. So these are the structures which you can see in the inferior surface of the tongue. Now here is the diagram. Now in this diagram you can see, first of all, this is the frenulum. This is the frenulum of the tongue. If you go laterally on either side, then you can see the deep lingual veins, and on the either side, lateral to the deep lingual veins, this is the plica fimbriata, which is again a fold of mucous membrane. Okay, so these are the structures which can be seen in the inferior surface of the tongue. Inferior surface of the tongue is also covered by mucous membrane, but it is smooth in nature, where papillae are absent. Okay. Next part, the most important one, is the muscles of the tongue. Okay. Previously also I have mentioned few times about the muscles of the tongue. Okay, so two different types of muscles are there in the tongue. What are they? What are the two different types of muscles present in the tongue? Okay, so that is the extrinsic muscles and intrinsic muscles. Two different types of muscles are there, right? Now, if you see the extrinsic muscle, what are their function? The extrinsic muscle mainly cause different movements of the tongue. Okay, and intrinsic muscle, what are the functions? It changes the shape of the tongue. Two different group of muscle, two different function. Okay, a median septum is there. On the either side of the median septum, those muscles are attached. Okay, so first the intrinsic muscles are also there. Now in the intrinsic muscles, what are the muscles? Can you name the intrinsic muscles of the tongue? Superior longitudinal, inferior longitudinal, transverse and vertical. These are the intrinsic muscles of the tongue. Intrinsic muscles का function क्या है? As I said, changes the shape of the tongue. And those muscle origin insertion, they are in the tongue itself. Okay. So those are the intrinsic muscles of the tongue. Now if you see the superior longitudinal, what will be the function? In superior longitudinal, shortens the tongue, make the dorsum of the tongue concave. If you see the inferior longitudinal, shortens the tongue and make the dorsum of the tongue convex. Okay, so these are the functions of the longitudinal, superior and inferior longitudinal muscle. Next, transverse and vertical. If you see the transverse muscle, what they will do? It will make the tongue elongated. That means it will make the tongue narrower. Okay, and vertical muscle will make the tongue broader. Okay, these are the functions of the intrinsic muscles of the tongue. Okay. Next, extrinsic muscles are there. Okay, so 4 intrinsic and 4 extrinsic. 4 extrinsic muscles, what are there? You can see genioglossus, hyoglossus, styloglossus and palatoglossus. Okay. Now, previously I have told you anything where the term glossus is added, it will be related to tongue. Okay. So here you can see all the muscles at the terminal part. Glossus is mentioned. तो इसका मतलब क्या है? That means it is related to tongue. Now here you can see the diagram. Okay. Now in this diagram you can see the origin of the muscle and you can see the insertion. So first you can see the genioglossus. Can you see the genioglossus? So this is the genioglossus muscle. It is a fan-shaped muscle. What is the origin? You have studied about mandible, right? Mandible is done in the class. Yes. So can you tell me the origin of the genioglossus? Superior genial tubercle. That is the origin. Okay. So after origin you can see it is distributing just like a fan. Okay, the fibers are spreading just like a fan, and throughout the length of the tongue, you can see the fibers are inserted of the genioglossus. And along with that, the lower fibers of the genioglossus, they will go and they will attach to the hyoid bone, as you can see. Okay, so from superior genial tubercle, the fibers are coming and then they are spreading just like fan. And where they are attached to the whole length of the tongue. And the lower fibers, you can see, they are attaching into the hyoid bone. Okay, so that is the genioglossus. Next is the hyoglossus. Do you remember the hyoglossus muscle? Where we have discussed about the hyoglossus muscle in the submandibular region. Okay, and I have mentioned that the hyoglossus is the key muscle of the submandibular region. Hyoglossus is the key muscle of the submandibular region. So here you can see this is the hyoglossus muscle, quadrilateral shaped. Okay, so from where it is arising, can you see the origin of the hyoglossus muscle? From respect of the hyoid bone. Okay, greater cornu and adjacent to the body of the hyoid bone. You can see it is arising. Now it will be attached to the side of the tongue. Okay, you can see it is attached to the side of the tongue, that also on the posterior half of the tongue. Okay, that is the insertion of the hyoglossus muscle. Okay, next you can see this is the styloglossus. So from where it is coming from the tip of the styloid process, and then it is inserted into the tongue. Okay, throughout the length of the tongue, that also on the lateral aspect, both the side. Okay, next you can see the palatoglossus, which is coming from the soft palate. Okay, so side of the tongue, okay, oral and pharyngeal part only. The oral and pharyngeal part only, this is attached. So that is the palatoglossus. Okay, so like this, four muscles are there which are coming from the various part of the structures which are present around the oral cavity, and then they are attached to the tongue. Okay. Next, so already I have mentioned that there are different movements which can be done with the help of the tongue. Now, what are the movements taking place with the tongue? Can you see the diagram? So you can see protrusion of the tongue. Okay, then you can see retraction of the tongue, elevation of the tongue, depression of the tongue. These are the main movements which are taking place. Okay, so what is the meaning of the protrusion of the tongue? Yes, you can take some part of the tongue out of the oral cavity, right? That is called the protrusion of the tongue. Once it is protruded, again it can go inside the oral cavity. That is called retraction of the tongue, right? Then you can elevate the tongue, you can depress the tongue. So these are some important movements which are taking place in the tongue. Don't compare it with the synovial joints. Okay? Don't compare it with the synovial joint movement of the synovial joints. Now, for each and every movement, different muscles are responsible. So you can see protrusion, most important movement. For that, which muscle is responsible? Genioglossus. Okay, for protrusion, genioglossus is responsible. Retraction, styloglossus, because it is attached posteriorly and superiorly, so it can pull the tongue, which will cause retraction of the tongue. Okay. Now depression. So depression, how it will take place? The muscle which are situated below. From below, it is pulling the tongue downwards, which will cause depression of the tongue. So that will be done by the hyoglossus muscle. And elevation, palatoglossus, means from above it has to pull the tongue. So that is done by the palatoglossus muscle. Okay, so movements of the tongue and muscle causing them are not that difficult. It's very simple. Just you have to understand the origin and insertion of the muscles, and then easily you can understand the movements, various movements. Okay. So that is all about the extrinsic and intrinsic muscles of the tongue, and along with that the movements. Next is the blood supply of the tongue. Okay. Now tongue is having rich blood supply. Okay. So which is the main artery supplying the tongue? That is the lingual artery. Okay. Lingual artery is a branch of external carotid artery. I think you have studied the branches of external carotid artery. Yes. So lingual artery is a branch of, and that day also I have explained about the lingual artery, the parts of the lingual artery, codes of the lingual artery, all those things were discussed. Okay. So tongue is not supplied by one particular artery. Okay. Multiple arteries are there which are supplying the tongue. That's why in the beginning I have mentioned that tongue is having rich blood supply. Okay. As you can see, the branches of lingual artery, which is the chief artery of the tongue. Okay. And then tonsillar branch of the facial artery and ascending pharyngeal artery. Okay. So these are the arteries which are supplying blood to the tongue. Only lingual artery is not supplying blood to the tongue, other branches are also there. Okay. Now there is an important part related to the lingual artery, that is the deep lingual artery anastomosis with the lingual artery of the opposite side at the tip of the tongue, and that is only the anastomotic channel which is formed in the tongue. Now you have studied that the anastomosis is taking place. A particular organ, when it is supplied by blood, especially the arterial supply, at that time anastomosis is taking place. Means blood from the either side will anastomose and then will supply the organ. If anastomosis is not taking place, then what does it call? End artery. Then it is called as end artery. Okay. Anastomosis नहीं हो रहा है, मतलब एक ही साइड से blood जाएगा. So if this particular artery is blocked, the organ will not get any blood supply. Best example is appendix, the appendicular artery, which is a end artery. Okay. So in case of tongue, it is not like that. Okay. Anastomosis is taking place between the deep lingual artery. कहाँ पे anastomosis होता है? At the tip of the tongue. Okay. Next, venous drainage. Venous drainage, deep lingual vein. Okay, and along with that, vena comitants are there, which are present along with the hypoglossal nerve and along with the lingual artery. Ultimately, the deep lingual vein will drain into the internal jugular vein. Here you can see the diagram of arterial supply of the tongue. Okay, as you can see, this is the lingual artery, main branch supplying the tongue. Okay, you can see these are the branches of the deep lingual artery, mainly supplying the tongue. Okay. Next, here you can see these are the tonsillar branch of the facial artery and branches from the ascending pharyngeal artery. They also supply the tongue. Okay. Next, the most important part in the tongue after the muscles are the nerve supply of the tongue. Okay. Now, why the nerve supply of the tongue is important in case of tongue? Do you remember the dorsum of the tongue? How many parts are there? Dorsum of the tongue में कितना parts रहता है? 3 parts. Anterior 2/3, posterior 1/3, and posterior most part. Okay, 3 parts. Nerve supply is different. Okay. So first of all, you have to understand that tongue is mainly made up of what? Skeletal muscles. So the nerve supply which is supplying the skeletal muscle, those fibers are called as motor fibers. Okay, those fibers are called as motor fibers. You have to understand. Then some glands are also situated along with it, mucous glands. For that, parasympathetic fibers are there. Okay, those are also called as secretomotor fibers. Okay, as you can see for anterior lingual glands. And then sensation. 2 different types of sensations are there in the tongue. The general sensation and special sensation. What is the special sensation? Taste. So like this you have to differentiate, okay, in case of nerve supply. Okay. So in the nerve supply of the tongue, Okay, so here you can see the nerve supply of the tongue. See, repeatedly I am telling you that tongue chapter is very important. Okay, so from the nerve supply, blood supply, even lymphatic drainage of the tongue, you can expect 5 marks question. Okay, don't ignore this. Now the question is, suppose मान लो exam में अगर question आया कि write about the nerve supply of the tongue. Okay, so how you will be writing about the nerve supply of the tongue? Directly, if you start the nerve supply of the tongue, it will not create that impression. Okay, for that what you have to do, you have to segregate the nerve supply. How you will segregate? Now in the tongue we have discussed that muscles are there. Okay, intrinsic muscle, extrinsic muscle. So for that, which type of fibers are responsible? Motor fibers, which will supply the muscles, and all the muscles are skeletal muscle. Okay, first part. Second part, as you can see, secretomotor fibers or secretomotor supply. They will supply what? Lingual glands. Which glands? Those mucus secreting glands which are present. Okay, I am talking about for those glands. So from where the fibers will come? They will come through secretomotor fibers, especially from the superior salivatory nucleus. Okay, do you remember the submandibular ganglion? In submandibular region, we have discussed about submandibular ganglion. That day I have written about the classification of the ganglia in our body, different types, where they are situated. We have discussed about the ganglia. You have not studied, that's your problem. But I know I have explained it in the class. Okay, same thing will be repeated over here today. If you have not understood the connections of the submandibular ganglion, you will not understand this. And that day also I told you submandibular ganglion is very important. You can expect 5 marks question. Okay, mainly about the connections of the submandibular ganglion. So secretomotor fibers are there, and sensation. 2 types of sensations are there: the general sensation and special sensation, that is the taste sensation. Okay, so like this the nerve supply of tongue is divided. Now you have to take one and then you have to explain. That also, whenever you are taking about each and every part, okay, anterior 2/3, posterior 1/3, and posterior most part, again the nerve supply are different. Okay, so first of all, we'll see the motor fibers. The motor fibers will supply the muscles of the tongue. So this is very simple. All the muscles of the tongue are supplied by which nerve? Hypoglossal nerve, except palatoglossus, which is supplied by cranial root of accessory via pharyngeal plexus. Okay, in head and neck chapter, you have to by heart these lines. Okay, as you can see, all the intrinsic and extrinsic muscle except the palatoglossus supplied by hypoglossal nerve. Okay, and palatoglossus supplied by cranial root of accessory through pharyngeal plexus. You have to by heart this line. Okay, next you can see secretomotor fibers. So preganglionic fibers are coming from superior salivatory nucleus. Okay, they will go through chorda tympani nerve of the facial division, then lingual nerve, and then they will rely on submandibular ganglion, the ganglion which we have studied last week. From submandibular ganglion, postganglionic fibers are coming out. Okay, and then they will they will go by lingual nerve, and then they will supply the glands, anterior lingual glands. Okay, next is the vasomotor fibers. Okay, the vasomotor fibers are mainly derived from superior cervical ganglion from the sympathetic trunk. Okay, and then is the sensory. Now for the sensory, you can see lingual nerve, general sensation, and chorda tympani is for taste sensation. That also for anterior 2/3 of the tongue, except the circumflex papillae. For posterior 1/3, that is the glossopharyngeal nerve, for both general and taste sensation, including the circumflex papillae. And if you see the posterior most part of the tongue, that is the internal laryngeal nerve, branch of superior laryngeal nerve. Okay, so like this, the nerve supply has to be segregated. Okay, and then only you can write the nerve supply of the tongue. Now here you can see the diagram. In this diagram you can see so this is the anterior 2/3, this is the posterior 1/3, and this is the posterior most part of the tongue. As you can see, the nerve which are supplying them, it is different, it's not same. Okay. So please try to understand the nerve supply of the tongue, okay, along with the diagram. And as I said, it is very important. And don't ignore the submandibular ganglion, mainly the connections of the submandibular ganglion. Okay. Okay. So today we'll stop over here. In the next class, I will continue from the lymphatics of the tongue, followed by the applied importance of the tongue. Thank you.